Welcome to Dance to Heal. I'm your host, Jenny C. Cohen. Join me as I share stories of how dance and movement can bring healing in a way that is safe and tailored to your life. I'm a cancer survivor, mother of two, and an award-winning performer who found that movement was vital to my recovery. I created Dance to Heal Wellness and also authored the best-selling book, Outside in Recovery, Dancing My Way Back to Myself After Breast Cancer. I will bring new techniques to help you on your dance journey and healing path. Are you ready to move? Dance to Heal starts now. Hi everybody, welcome. I really have a very special guest today. Marly, who is the creator of MedCompanion, is here. Her full bio is in the description, and then before we get her to start talking, I do want to direct you to her website. Go to medcompanion.com and click a button and get yourself into the system. Why? Because you would much rather have a service like this already set up in case you need it than be in the stress and trying to set up something like this for yourself in the future. Okay, so without further ado, welcome, Marly.
Hi, Jenny. Thank you so much for having me today.
Thank you for being here. In your description, it refers a little bit to it. However, will you tell us the backstory of why you started this company?
Absolutely. I started this company, I think, if I'm being truly honest, in my head, probably over a decade ago. I was working as a medical scribe, and for those that don't know what a medical scribe is somebody that stands next to the doctors and they write down everything the doctor is saying. They're transcribing everything that's going in the room. And I loved doing that. I loved working with all these doctors. But time and time again, I used to see patients leave confused, come back, not have taken their medications, not have taken um, the lab work that they needed or scheduled a visit that they needed. And ultimately, they were coming back, paying extra money, and not getting the outcome that they wanted because they didn't know what they didn't do what the doctor told them. So I think really it kind of started back then. But it wasn't until I personally experienced this with my grandmother, who was diagnosed with cancer. And I saw her really go from having her life together, her health on check, and just taking such good care of herself, taking such good care of herself. And suddenly, a cancer diagnosis just completely lost her in that system. It was so broken, it was very difficult. And even for someone as myself who is in the system, who understands it, the ins and outs, I realized that there wasn't a lot of support and it was very difficult to navigate and do things for her as an outsider, basically, trying to support her. So, unfortunately, as a result of that, she passed very quickly. She ended up missing an appointment that was very important. There was some confusion and error in the scheduling. She didn't make it on time, and that was the one that was going to determine how aggressive her cancer was. So by the time that she started to feel worse, her cancer had progressed so fast that she ultimately passed within 3 months. And that was really like the fire, the trigger, because when I was in that grief, when I was thinking about my grandmother, I was simultaneously thinking about all those patients that I had seen over a decade go through the same thing. And I was like, somebody should do something about this. Somebody should try to change this. And I started going down this rabbit hole, trying to figure out like what is out there, what kind of advocacy, what kind of support. And I didn't find it. And I never considered myself someone that was entrepreneurial, looking to start a business. That was never my plan. Um, but I remember also thinking, like, I am somebody and I know this system. So can I change it? And that's when I had this brilliant idea at like 2 in the morning, woke up my husband. I was like, I got it. I know how I'm going to fix it. And that is how it all started. So I started MedCompanion as a virtual advocacy program that places a human virtually with a patient to help them navigate and understand their health.
And this, I love this. It's an advocate for that person who's in front of the doctor, right? I mean, so audience members, Marley and I, we know each other from a mastermind and also separate conversations. And we go off on our stories about our family members who, for them, English isn't their first language, right? So there's that stress of being not well. So then you revert to your primary language, which may not necessarily be English if you're here in the States. And then I was saying to her, yeah, I mean, even for English speaking people, like I'm almost English is now my primary because I've been in this country for so long. When I was going through my cancer care, my husband went with me to most of the appointments because I would suddenly turn into just this like 3-year-old in front of the doctor. I wouldn't remember my details. I wouldn't remember what meds I was doing. Besides my charts, anything that happened since my last appointment, my husband would be like, well, did you remember to tell? No, I forgot. Let me tell you what they did. So it was really interesting that oftentimes, if you're usually not one that gets sick, you forget that on both sides of it, you either need to be there as the advocate for your parents or children or spouse or partner, or you need one for yourself when you're there.
100%. I mean, I have a MedCompanion that goes with me to the doctor because when I am there as a patient, I'm not thinking about all the questions I need to ask, even though I do this for a living. It's a completely different situation when I'm there as a patient. And I've been there as a mother too. I have 2 young kids that have required some medical attention. And my husband is a physician, and we've both gone to the doctor, and we're not there as these healthcare professionals. We're there as a concerned mom, as a concerned dad, who all of a sudden are being told our son needs surgery for his thyroid, or not his thyroid, his adenoids, that he needs surgery for his eye. And we're like, surgery, that's the last word I heard. So having a med companion there, even for people like us who are healthcare professionals, is very helpful because you go into this brain fog where you're not there anymore as a professional. You're there as a human being, as a mother who is concerned for your child or your loved one or your parent.
Excellent, excellent point. Oh, I love this. And before I hit the record button, my audience members, I want to tell you, we were talking about the art of the pivot. Marley, tell us the story of what your dad noticed about you whenever you would ask for help.
Yeah, so I've always been this girl with a big imagination, and I love structure and I love plans. So in my family, I'm known as the girl with the plan, the girl that tells God what she's gonna do. And what is so interesting is that I've generated all these plans of what I feel my life should be, what I feel my life should look like, what I feel my childbirth is going to be. And none of those plans have happened. It's like I create and spend all this time creating a plan only to like face plant because it doesn't go according to my beautiful plan. And now I am left there to pivot. And my dad likes to say, you must give God a really good laugh because you bring him your beautiful plans, and God's like, that's cute, honey. No, here's what I'm going to do. So I think in life, I still plan everything. I still write it down. I still have this beautiful plan. And I can honestly say that nothing has ever happened from my plans.
I love that. I love that. Audience members, do you also have this issue? I am known for being the person that can't hold on to a planner longer than 6 months. I need a new plan. And I got in trouble with a business mentor for having too many planners. I had like 4 different planners, and she said, no, one planner is more than enough. I'm like, great, but I have now 7 different Google planners, right? And a Calendly planner. But I have that one written one where everything's written down so I could keep track of it. I am also the person that loves to plan because I always felt so powerless as a child, right? And I love the reminder that there is okay, so for those of you who don't ascribe to a higher power, there is needs, maybe needs. No, there needs. I'm going to put my foot out there. There needs to be acknowledgement that there are powers beyond our comprehension at work. And we're all connected in some way that is not fathomable in our human form, Okay.
Right.
Because, I mean, they can't even figure out, science hasn't figured out why we're alive. They don't know what the spark of life is, right? That keeps us, they know how it works when we're alive, but they don't really know how to, they can kind of implement, they can imitate it with cloning, right? But there's still that spark of life thing they haven't figured out yet, that magic. And because of that, we always make plans, and somehow there's this grace that saves us.
Yeah.
Always, right, Marley? And so I had a plan. I was gonna, when my husband proposed, I was like, great. I could totally see him as the father of my kids. Let's do it. And then my husband got testicular cancer, Marley, and we had to go through in vitro.
Oh my goodness.
Yeah, and then it was like, all right, let's go do in vitro. And then he discovered that I had severe endometriosis and I had a large cyst on my ovary.
Oh my God.
So I learned that silver lining, right, around, oh, it's beyond you to understand why Michael got cancer. Don't try and understand, right? Don't try and plan. Then we're like, all right, well, we're gonna have our babies, right? And life's gonna be great. And then when I got pregnant and had our kids, I ended up giving birth because we were supposed to deliver the baby. They were supposed to come out end of January, and my baby was like, nope, Christmas Day, mommy's gonna go into labor the whole day, Christmas Day. You're gonna be in labor, you're not gonna know it because you have a high pain tolerance. And then they came, December 26th at like 12 o'clock in the morning, right? Then my son got type 1. He was only 10 and he got type 1 diabetes. Marley, I was so mad. This miracle baby didn't have a great, easy, happy life. And now you give my precious miracle. God, how could you do this? Right? And then it was only after I got cancer. A lot of things happened in between. Then I got, that's another episode. You come back, we'll talk about that. And then I got breast cancer. And in the middle of my chemo, I had to do 16 cycles of it. I got a download from God because I was actually able to hear God when I was really sick.
Wow.
The answer was, Danny got type 1 because he needed to be slowed down. You didn't need to understand this.
Yeah.
That's not the lesson for you to learn.
Right.
And all the times that you thought you were the person keeping him alive in the middle of the night, I was doing that. You had nothing to do with it. Like you were never alone.
Yeah.
Right? And so audience members, Marley's company helps you feel less alone.
Yeah.
Right? So a lot of us are alone now.
Yeah.
And there's ways to not be alone. Loneliness is one of the precursors to disease in your body.
Absolutely. Yeah, no, that's very true. And wow, you've gone through a lot too. That's a lot to handle for for a person as a mom. But you're so right. Like it's sometimes not even for us to understand, and sometimes that lesson comes later in life. But one of the things that our company focuses on is really, yes, we do advocacy, we do all of these things, but it's truly bringing the human element back to healthcare. There is so much technology, and don't get me wrong, I love technology. We use technology, we integrate technology, but we've also recognized that without the human element, that connection, that understanding, and that desire to improve, to get better, to have a bigger purpose as to why you're working for your health is lost. And at MedCompanion, that is one of the things that we have as our core is to make sure that we remember that we are all humans first and that we bring that human connection back. We were recently featured in Forbes, and one of the things that they said was, we are the human prescription, right? In healthcare, everything is so driven by technology nowadays, and it's so fast paced. Doctors are retiring. There's less and less doctors. There's less and less resources. So that human component has been lost. And as a result, patients are lost, patients are confused, patients are frustrated, doctors are tired, doctors are frustrated, they're burnt out. Like it's this never-ending cycle. So we're trying to really bring back that human component and be that bridge between those burnt out doctors who need the support to better care for their patients, and then those patients and families who are lost and just trying to understand. So that is really where MedCompanion comes in, and connection is just so important.
Will you please explain a little bit more of what MedCompanion does for someone besides someone who they would call up on the phone to translate? Because we do, sometimes I've had people go, oh, well, like, for example, I don't live anywhere close to my parents. And every time my mom's had an emergency, I fly from Utah to Massachusetts. And always this whirlwind last minute. I have to try and find the next flight out to get to them. And sometimes my parents will be like, oh, we didn't call you because we could just do the phone. I'm like, you've complained to me about before. Why would I trust a phone person who knows nothing about you trying to translate for you with the doctor?
Yeah. Yeah. So, when we talk about translation, we're not necessarily translating different languages at the moment, but we are translating the medical terminology into plain language for people. And ultimately, what we do is we attend your doctor visits with you through a private app that we've developed in order to basically be there almost as if you were on FaceTime with a buddy at the doctor's office. And because we know you, because we've been working with you, we know what's going on in your life. We know what changes have happened. We know what questions you've asked us that you want clarification. So when you're at the doctor and you're like, "Oh, I don't remember, I'm so nervous. Did my cancer come back? Did this happen? Oh my gosh." And you're super stressed out. Well, your med companion is in control. And they're like, "Oh, by the way, doctor, Jenny had concerns about her new medication that she wanted to talk about. Oh, her husband was also worried that the new medication may be making her a little bit too tired, and they wanted to know if maybe the dosage was too high, or maybe we had to try something new." So the Med Companion is really like helping you navigate that scenario. And is also an additional resource not only to you, but to the doctor, because if the doctor now has things for you to do or say, "You know what, Jenny, I think that you're right. Your blood pressure medication does look like it hasn't done anything for you. I want you to go see a cardiologist. I want you to go start this new treatment. I want you to start this new prescription." Well, you're probably nodding your head in the doctor's office, and then you walk out and you forget all of that. So your med companion already has this action list that's like, "Jenny, I'm so sorry that you haven't been feeling well. We're going to call your insurance. We're going to verify that they cover a cardiologist. Do you have a preference of whether you see a female or male cardiologist? Do you have a preference how far you have to drive for your cardiology appointment? Okay, what days are you available? Oh, you're available next week? No problem. We are calling the cardiologist for you. We are calling your insurance for you. We are fighting with your insurance if they say, no, we can't approve this for Jenny. We're like, no, you will approve this for Jenny because this is what happened. And we are doing all of these things to make it super easy for you. Your job is to take care of you and show up to your appointments and show up to your blood work. And our job is to call, to spend time on the phone, to make sure your doctor knows what's going on, to make sure we get your prior authorizations, to make sure we get your prescriptions refilled. Your job is to just go pick it up, go to your doctor, and do what you're supposed to do as a patient and nothing else. You're not supposed to be managing your health this crazily behind the scenes.
I love the details you just went into, Marley, because my kids are now in their mid 20s learning to navigate because, legally they're adults, right? And everywhere they go, they have to give the permission for me to have any access to their personal things. And it's not that I wouldn't do it for them. They're learning that in part of their life skills. Oftentimes, I've heard my friends, a lot of them are in the service industry, and so they couldn't necessarily afford healthcare. So they're like, I don't bother with it. And I'm like, because you can't afford it. And now that you can, some of them through some of the governmental implications in implement government access programs, they can have health insurance. And they're like, whoa, there's so much to do behind the scenes for care. And as we navigate this with my kids, they're exhausted. And they're like, how did you do this? It's like my son who just got his license in his 20s. Mom and Dad, it's exhausting driving like 7 times a week. And we're like, yeah. And he's like, how did you do it when I was training in ballet 6 days a week? And you had to go back and forth and pick me up like twice a day. Mm-hmm. Right? And people don't understand that. And that takes away from your healing time.
Yes. And it elevates your stress level, which elevates your blood pressure. And it's just this never-ending cycle. And I'm going to share this story. I do have permission from my mom to share this story, but I have my parents on their own MedCompanions. So they have their own MedCompanions. I'm a very busy person. I'm a mom. I'm running a business. I want my parents to be taken care of, but I just don't have the time to be the person to do it. So I have them on a family plan and they have their own MedCompanions. Um, I know what happens behind the scenes for my mom to go to her doctor's appointment. And she recently had to go see several specialists as part of her annual exam and annual wellness. So her med companion booked everything. To my mom, it looked very smooth. I called her. I was like, "Hey, mom, how did it go? How was your appointment?" She's like, "Oh, it was so easy. I showed up and they already had all my information. They had all of the referrals I needed. I just showed up. I was in there. I was out of there in 15 minutes, and it was the best experience." I'm like, "That is wonderful." Meanwhile, in the background, I am laughing and like letting my med companion know that she did a phenomenal job because I know that while it was easy for my mom, her med companion spent 4 to 5 hours on the phone making sure that everything was ready so that my mom could just walk in, give her insurance card, see her doctor, walk out, and make it as seamless as possible. But in the background, it took probably like 20 different calls, calling the insurance, verifying that things were in network, verifying that the insurance covered that, because it's not easy. Like oftentimes, you could go to an in-network clinic, but the doctor group is out of network. So now you're stuck with this very big bill that nobody told you about. So one of the things that we do is like we always verify to make sure like, okay, is the clinic covered? Yes, great. Is the doctor covered? Oh, wonderful. Is the machine covered? Because you know what? Sometimes the machines are also out of network. People don't know this. So we have to make sure that we're crossing all of our T's before the patient shows up, because the last thing we want is for our patients to end up with a ridiculous bill. And most of them who come to us, they're like, "I just paid like $500 at this visit because my doctor referred me there, but my insurance didn't cover it." So we're trying to do all of that back end work to make it as easy and seamless as possible. So when our patients are saying, "Oh my God, that was so easy," it makes us really happy because we know that on the back end, it was not easy. We probably had like 3 or 4 fights with insurance before they said yes, but we made it happen and we worked behind the scenes to make sure that it was easy.
Yeah, that story just gave me chills because it's literally what it was like. Thanks for listening to Dance to Heal with Jenny C. Cohen. Come back next time to hear stories of recovery through movement and learn more ways that you can move your body. To work with me and continue your journey, visit outsideinrecovery.com. Are you ready to move?